Everybody, welcome back to Bayou Time. I'm Harry McCullough, and unfortunately, we're talking COVID again. And for that, we bring in Dr. Chip Riggins, Louisiana Department of Health and Hospital Region 3 Director. Sorry we don't bring you in when we're doing better, right? When our numbers are all down. We bring you when things are going a little bit in the opposite direction. And it seems like there's been, I guess, the 600% increase in the number of COVID cases over the while. And a lot of that is to blame, I guess, to the Delta variant?
Yeah, this feels different, Harry, and to us in public health, it feels different, it looks different, the data is different. So we believe that, yeah, for all intents and purposes, this is the Delta variant. And we kind of watched it across the country, and we hoped that maybe we had some herd immunity and it would stop, or we wouldn't see this. But the last couple of weeks have been disturbing. It's been alarming, the number of cases that we've seen.
Yeah, we've seen a lot of it. Now, is this one seem different? Are y'all testing for the variants? In each case that comes in, when somebody will go to the doctor's office, well, you tested positive for COVID, they'll send that off to, I guess, the CDC or you guys or any labs, and then they'll test for the variants. Because most doctors I talk to go, I don't know if it's a variant or not. We just send it off.
That's right.
Is that the case? How do y'all know?
That's right. The rapid tests don't tell us that. So what they have in their office usually doesn't allow us. We call it sequencing, or do that DNA probe to see if, in fact, and we're having to settle for a small number of samples right now. Hope to be able to grow that. But as we saw this, the CDC's announcement that the majority of the COVID cases are in the country now are the predominant strain is this Delta variant. So yeah, it resembles that. We are seeing we know that the Delta variant is more transmissible, and we're definitely seeing that in the clusters that we're observing and how many people in groups are coming down with COVID together. We see that increased transmissibility. We're also seeing it really kick some young people who are used to having very mild cases, or seeing very mild cases. It can be more severe.
Right. This has become such a political thing, you know. I mean, I look at our state. We're 39% people that have received the vaccination. And it almost goes in line with a lot of other political things, that same number, right? 60-40, that kind of stuff. I'm not saying it's along political lines, but when you guys, it seemed like everybody was really moving along with the vaccine, and there seemed like a parachute came out, and really not enough people. I guess we haven't reached herd immunity, I guess.
No, I think if we were at herd immunity, we'd definitely be suppressing these clusters, and we wouldn't be seeing this rise that we've seen now for the last couple of weeks. This is now kind of undeniable. It's region-wide. The arrow's pointing up in all of our parishes. Our hospitals have seen a doubling or a tripling of the number of inpatient COVID cases that they have here in our region. So, yeah, like everybody, I think I was hopeful that we had some degree of herd immunity, but I think that question's being answered for us as we speak, as this Delta variant comes through. If we were there, I just don't think we'd be seeing these clusters and this rapid rate of increase.
So we've all getting used to just going out again, right? We've been in our houses for a year and a half. What is going to be different this time? Do we know anything better now? Did we learn anything about how we can treat things, or are we looking at shutdowns and mask wearing and those types of measures again?
I think we're going to have to watch our healthcare system. We're going to have to watch our hospitals, and we really do owe it to them. They've been heroic throughout this whole pandemic, and we're going to have to keep a close eye on them and make sure that they don't get overwhelmed. That has a snowball effect on other conditions, and we don't want to see that again. So I think that's going to depend. We're going to have to take a wait and see in terms of that. I think, we want to keep the pendulum from just swinging wildly back and forth, and I think the moment right now, the real key is to use this moment, recognize what's happening, and go ahead and try to reach that herd immunity level through the safe road, as you and I have talked about before, which really is vaccination.
And at Region 3, how are we doing with hospitals, and where are we at with that?
I think they're okay. They average during our lull, when we were enjoying that respite, that return to normality, they were averaging less than 10 cases. We have 11 hospitals, so that's less than a case in each facility at any given time. We were seeing that on a regular basis. I think we're between 30 and 40 cases in the region now, so really a tripling of that. And a lot of our residents also do seek care outside the region, so it's hard to know if but that's how our local facilities are still handling it. But we're just going to have to keep an eye on that.
Well, most of our healthcare workers and most of our elderly are the high levels of immunity, right? So that's at least a silver lining, that most of the people that are getting it now are on the healthier side, that might be able to handle this.
Yeah, I think so. I think we're going to have to see. We're going to kind of have to see how deep or how high this uptick is in cases. And again, I think taking it seriously for folks that were saying, let's take a watch and see. I think we might be at herd immunity. I think that question is being answered for us as we speak. We're not quite there, so we really do need to buckle down and get out for the vaccine.
So this Delta variant, we think, may be responsible for quite a big uptick of cases in our area. But that's not all. It's a different time, right? This is the middle of summer. We don't usually deal with flus, that kind of stuff. And we've also seen other things, right? Respiratory illnesses. Was it RSV, right?
That's right.
It's just a different time for some reason. Huh?
It is. It's something I know I haven't seen in my career. It's very unusual to see respiratory syncytial virus, usually in the wintertime when we're really locked up, when we really are indoors more, when we warn parents of newborns to really keep their kids, out of public because RSV's in the community. So yeah, we're seeing that. I know a lot of pediatricians have seen a lot of RSV here in the community and had to refer some of those. And RSV doesn't hit just the babies; it hits seniors pretty hard as well. So yeah, we're kind of having to deal with the double whammy right now.
Right. So you suspect it's a Delta variant that's causing a lot of these clusters of people. A lot of it, like I say, it doesn't seem like the people that are vaccinated doesn't seem to be as tough on those folks, but people unvaccinated, seeing a lot of those people rise in hospital cases. We're about to start school again in August. 12 and under can't get a vaccine yet. Do you think we'll see any different guidelines? Because they're talking about kids going back to school without masks now in regular school systems.
Right. Those who are vaccination age and who are vaccinated will be able to have a more normal school experience, hopefully. But yeah, the CDC came out with those guidelines. That's going to trickle down through the state, and then each individual school board will kind of deal with that and have that local control, if you will, based on what's going on in the community. And so we always talked about the need to be flexible and to make minor adjustments rather than huge swings. Don't lock everything down or just forget that there's a pandemic going on. We really need to be making those minor swings as a community and just get accustomed to having to adapt a little bit as the disease and these variants present themselves to our community.
Right. How tough has it been? When we worked so hard to find these vaccines, a lot of work and energy went into it. A lot of work on it, and that some people just don't believe in it, and that's got to be tough from your standpoint. Like, hey, we've got a thing that can help us out a lot, and we're still sitting at 39% as a state.
Yeah, it is hard. The vaccines really are a wonderful technology. They've been refined for so long, and all they do is really stimulate. They provide a temporary stimulation to our immune system that really primes us and prepares us and gives us that immunity to fight off these infectious diseases. So yeah, it does hurt to see the loss of confidence in a technology that has really created the society that we enjoy today. You know, our grandparents and great-grandparents had to deal with polio in the summertime. They had to deal with smallpox and other killer diseases that we don't even see anymore. So yeah, I hate to see the larger loss of confidence in that technology, because it truly has been life-changing and much of what makes our country what it is.
Right. It truly has been remarkable, and it's become more of a political thing than a health thing, you know. And it's just been weird to watch as we've done it. We do have over 3.3 million doses beginning in Louisiana. That's got to make a dent, though, right? And as we were talking, I think we've worked well on nursing homes. At-risk elderly seem to have that's 70-something% of that population has been had the vaccine. We've also had most healthcare workers have gotten a vaccine, but we still got a long way to go, and I'm sure there's still at-risk groups that are out there.
Yeah. Really working together. I heard some surveys that parents of young people, and you know, in the summertime, are really trying to we've got 3 events in schools going on as we speak, as a matter of fact, this afternoon, making it available to the kids in the 12 to 18 age group, because you know they need 2 doses before school starts to be fully immunized and ready to go. So but I understand parents want to really get that from their doctor. They want to get it from their pediatrician, their family doctor, or their usual medical home, and we respect that. We've really worked with the physician community, with the pharmacy community here, to really make sure that wherever you prefer to go, wherever you feel that trust, you know, please check with them, because whether it's with their recommendation or whether you can get it directly from them, really, we've built a great system. Our community is really mobilized to make the vaccine just widely available. Just got to
go get it.
Just got to go get it.
Got to put a shot in the arm. We have about 30 seconds to go. It looks like Pfizer's talking that we're probably going to have a 3rd vaccine, a booster. Do you look for something like that coming in the fall?
Yeah, I think the data and the Delta variant has given us, unfortunately, some good data to see how long the protection lasts in the different age groups. So yeah, I fully expect that for certain age groups, they'll start becoming a little more definitive in terms of when various folks might want to get their boosters.
Yeah, and you know, even people that have had vaccines are still getting it, but it seems like for most people I've been talking to, it's not quite as tough on the people that have had the vaccine. So we'll do that on a future show. Chip Riggins, thank you so much from the Louisiana Department of Health. We'll be right back right after this on Bayou Time.